So hi, I'm Alice, and this is Atsuko. So we're clinical research coordinators at the Dementia Research Unit. So here to talk to you about a day at the DRU. So welcome to the DRU. We're part of the Centre for Dementia Studies and Sussex Partnership NHS Foundation Trust, led by Dr. Naji Tabet, and we're a team of admins, research coordinators, clinicians and nurses. So at the DRU in Crowborough, we are dedicated to providing and improving treatment and care for people living with Alzheimer's disease and other types of dementia by carrying out a range of research studies. This allows us to explore new and innovative treatments and therapies and provide options for those who are using our services. The research can involve trying new drugs, trying new therapies, attending an interview or focus group, or completing a questionnaire. You can get involved by volunteering to take part. But what happens if you do get involved? So we'll be walking you through a day at the DRU, from when you walk in the door to completing cognitive tests, giving a blood sample, and then what happens to your blood in our lab. So we'll introduce you to our team and give you a tour of the DRU. And even those out of sight areas.
Okay, continue, that's fine.
That's okay.
Yeah, okay. So today we would like to invite you to Dementia Research Unit for a study visit of randomized controlled drug trial. So you arrive at the unit in the morning and we welcome you. And if you could go through the way to the lounge over there. So here is the lounge. You will spend most of the day in this lounge. It was renovated last year with support from the local golf club. And Professor Naji Tabet is the principal investigator of the study. And we would like to receive your consent for the study. And we'll discuss about adverse events and any new medication added since the last visit. So now you are settled, here's a plan for the day. We have a lot of tasks to go through and hopefully we can finish on time. Now I will take you to a clinic room for physical examination.
So this is our clinic room. Tammy is one of our research nurses who is here to conduct some physical assessments such as ECGs, vital signs and taking blood samples. Next slide. So please take a seat. We're about to take some blood. Don't worry, it's just a sharp scratch.
Thank you for giving us your blood and let's head back to the lounge for a break. Would you like a cup of tea or coffee? And please feel free to read a magazine and have a go at the puzzle book.
So while you're taking a break in the lounge, I'll take your blood sample up the corridor to Elise, one of our research coordinators in our lab. So in the lab, Elise will process your blood according to the study lab manual. This often involves using the centrifuge, which spins the blood to separate out the plasma. The plasma is usually extracted and frozen in one of our freezers, either at -20 or -80. So once you've had a break, we'll ask you to join Sarah, another one of our research nurses, in one of our interview rooms to take part in some cognitive assessments. These can include the MMSE, ADAS-Cog or MOCA. These assessments usually involve answering some questions that may assess your memory, attention or language. Whilst the person living with dementia takes part in some cognitive assessments, their study partner may be asked to complete the CDR. This is a semi-structured interview completed by the study partner and person living with dementia to assess their clinical dementia rating. Often the CDR rater is blinded.
Okay, so we managed to do a lot so far. During the summertime, we can serve your lunch in the garden. And while you are having lunch, we ask Professor Tabet to check all the documents and ask him to sign. And now we got a signature on the prescription. So I run to drug room and ask Sarah to dispense the trial medication / placebo. Drug room temperature is controlled and have 2 locks for the door and another lock for a cupboard.
So now you've finished lunch, it's time for the person living with dementia to complete their semi-structured interview for the CDR. Next slide. And whilst the person living with dementia is with me, Atsuko takes the study partner to another room to conduct some further assessments, such as the ADL, MPI, or EQ5D-SL.
And after all the assessments, Sarah will give you the boxes of the trial medications and go through with how it should have taken. And now we have done all the study visit tasks for today. And this is the end of the study visit. Thank you very much for your participation. We will see you again in 3 months' time. But if you have any concerns or adverse events, please contact us at any time. Now that the participants are left, we start admin part of study visit in the office. As we have shown you today, we work closely in teams and we all bring our skills and expertise to deliver research and support academic and commercial research studies in the background. We are looking forward to delivering your innovative research in the near future. And here's a list of current studies that are open to recruitment. And here's our contact if you have any questions. Thank you very much for your time.